orthopedic and spine surgeons and other physicians that use intraoperative fluoroscopy have been kind of slow to recognize the risks involved. A number of colleagues and some who were partners in my own institution, but people from across the country, surgeons from across the country, who in their middle to later years have been diagnosed with some form of cancer. The diagnoses extend from lymphoma and leukemia through solid cancers, particularly thyroid cancer and mesothelioma. One colleague who is about my own age who passed away just last year from mesothelioma. So those are, anecdotal considerations, but I think they are certainly a valid concern. In Seattle, Ted Wagner, who's very experienced spinal deformity surgeon over many years, his data is very suggestive that there's an increased incidence of both thyroid cancer and cataracts among members of the Scoliosis Research Society. So these are all surgeons that specialize in spinal deformity. Obviously, all of us want to live long and productive lives and spend our retirements with our families and enjoy activities beyond those of being able to take care of patients. So radiation safety is increasingly an important subject, not just for physicians and caregivers, but for hospitals and healthcare provider organizations from the standpoint of the obligation to keep their workforce safe. Obviously, the individual caregivers need to be concerned for their own safety and need to be active in monitoring and taking steps to avoid radiation exposure. Another part of the emerging environment are companies such as ControlRad that have developed devices that reduce and focus the radiation beam from a C-arm, and in doing that, reduce the exposure to the operating team without significant sacrifice of the image quality in the area that the surgeon is needing to visualize. These, I think, are a very economical safety measure and hopefully become a part of standard practice in most spine operating rooms.